Okay, I see the notice. So I apologize for the technical snafu, and I want to welcome you all to our Long-Term Care Planning Committee for December 14th. Just as a reminder, the governor's executive order regarding public meetings is still in effect, so we are taping this, recording this, and it will then get posted to OPM's website under the planning committee. Also, I don't know if they're still on. Yeah, they're there. So CTN is also taping us. So if you can, at least the first time you speak, if you can say your name, that would be helpful for them. So, so with that, maybe we can just, in the interest of time, just do quick introductions just of our members. Again, I'm David Gutchin, I'm the chair, and from the Office of Policy and Management. I'll just call in folks. Michael?
Mike Santoro, State of Connecticut Department of Housing.
All right, Michael. Jessica?
Good morning, Jessica Rival from the Office of Health Strategy.
And Laura?
Laura Watson with the Department of Housing.
Laura. Margie?
Margie Gerando-Marquette, the State Unit on Aging of the Department of Aging and Disability Services.
Okay, Kim?
Hi, good morning, everyone. Kim Risniak, Public Health Services Manager, Department of Public Health.
Okay, Stephanie?
Good morning, everybody. Stephanie Bozak, Department of Children and Families.
Okay, Melissa?
Melissa Morton with the Office of Policy and Management.
Okay, Erin?
Good morning, Erin Levitt Smith, Director of Long-Term Services and Supports with the Department of Mental Health and Addiction Services.
Okay, did I miss any members? Okay, and I want to thank members of the Advisory Council and other members and other individuals who are joining us today. I do also want to acknowledge that, as everyone knows, this is the anniversary of the Sandy Hook killings, and I just want to take a moment and remember those individuals and families who were impacted that day and are impacted by gun violence every day around this country and around the world, but especially in our country. So, so our first order of business is to vote on the 2022 meeting schedule that Melissa was kind enough to send out in advance. We will continue to meet on a quarterly basis on Tuesdays from 10 to 12. It would be Tuesday, March 8th, Tuesday, June 14th, Tuesday, September 13th, and Tuesday, December 13th. So we need to put that to a vote. Does anybody have any comments or concerns with that schedule? Okay, all in favor say aye.
Aye.
Any opposed? Okay, the meeting schedule is adopted. And our next item is if there are any updates from members or announcements. Take an opportunity to do that now. Margie, no grant? There you go.
Thank you. This is Margie from the State Unit on Aging. So the State Unit on Aging receives some vaccine funds as well as American Rescue Plan funds. I think I had shared that at the last meeting. I'm happy to say that our vaccine funds are in contracts to the area agencies on aging as well as the Centers for Independent Living so that those agencies can move forward with their plans for these funds. And we're working to get the American Rescue Plan or ARPA funds into the Area Agency on Aging contracts so they can get out to the community. Most of those ARPA dollars are to expand the work under the Older Americans Act during COVID as well as COVID recovery. Some of those funds are specific to respite, which will support our statewide respite care program. Thank you.
Thanks, Margie. Any updates from members? Okay, great. So let's move to our main agenda item for today, which is a discussion and finalization of the long-term services and sports plan and a vote on that plan so that we can transmit it to the legislature by our January 1st deadline. And before I turn it over to Melissa to give an overview of the plan, I want to thank everybody who has provided input on the plan, planning committee members, as well as the advisory council. I want to call out Michael Werner for his help in shepherding comments. And in addition, and Melissa will touch on this, Melissa held several listening sessions with various organizations and got some invaluable input from members of those organizations as well as members of the public. In addition, we got additional comments from members of the public, from individuals like Jay Katz, who had been on the call, but I don't know if he got dropped off. And other organizations and individuals. We got a lot of feedback for the plan this year, more than we've had in the past, and I think the result is a more comprehensive and valuable plan going forward. Last and certainly not least, I want to give a great shout out to Melissa Morton, who did the yeoman's work in putting the plan together. It certainly would not have gotten done without her, not only holding the listening sessions, but taking everybody's comments and recommendations and really trying to put together something that was as responsive as possible, and sort of weighing all the input we got, because we did have situations where we had varying viewpoints, and Melissa did a great job of massaging all of that, as well as putting together the meat of the plan beyond the recommendations. You folks had seen several drafts of the recommendations and provided comments, but in this last iteration, there was the data sections of the plan, and Melissa's the one who puts that together with assistance from Lori Kizabet at OPM as well. So I greatly appreciate Melissa's input on that. So with that, I'm going to turn it over to Melissa, who I think is going to share a PowerPoint to give an overview of the plan. And certainly we're not going to be able to touch on everything, but really to capture the highlights of the plan. So Melissa.
Okay, hopefully you're all going to be able to see my screen in a moment. Okay, can you see my screen?
Yep.
Okay, great. So as David said, I want to start off by thanking everybody here today, and for those who couldn't make it today, it was unbelievable the amount of feedback that was received on the 2022 plan. It was actually quite exciting, and I think you'll find some of the themes across sectors of the long-term services and support system to be really interesting, because what we learned along the way is that no matter where you touch the system, we have a lot of the same issues coming up over and over again that our plan can focus on addressing. So as David already briefly touched upon, the planning process this year, we did a couple different things. We started with our traditional methods, as we always do, by sending out the plan to all of you members of the planning committee. We share it with the Long-Term Care Advisory Council, who then shares it with all of their members. We distribute it to the Long-Term Services and Supports Rebalancing Committee, the CFC Council, the PCA Workforce Council, and we ask state agencies to please put it out over their listservs, post it on their websites, and solicit comments that way. We really try to get the recommendations and call for feedback shared widely. What we did differently this time around were two things. One, we created a public feedback form. I think that when we were sending out recommendations or sections of the full plan to members of the public, it can be daunting as to, well, how do I comment on this? What's an appropriate comment? How do I submit and enter a comment? How should I frame it? So we created a public feedback form that guided people through the recommendations that exist now, and asked some guiding questions and comments that would allow for members of the public to be able to more easily provide public feedback. And we ask that our partners share that feedback form widely, and we also posted it on our website. If anybody didn't see it, you can go right on the Long-Term Care Planning Committee website and take a look at what that feedback form looked like. And as David alluded to, we also this year held 4 public listening sessions. And these public listening sessions were, I had touched upon them at our last meeting. They were held in partnership with AARP, the ARC Connecticut, PATH CT, and the Keep the Promise Coalition. And it allowed us to touch and get feedback from 40 different members of the general public who are the ones who actually interact with the long-term services and support system that we have set up in the state of Connecticut. So we held all of these virtually, but as you can see from the slide, we were able to get feedback from a wide variety of utilizers of the long-term services and support system, from older adults to informal caregivers, individuals who are diagnosed with intellectual and developmental disabilities, individuals with mental health diagnoses, individuals with physical disabilities, and these individuals also lived in various settings across the system. So some were in the community, some were in group homes, some were in nursing facilities. So we really got to hear, get a good snapshot of people using the system and approaching it from different parts of our community.
Hey, Melissa,
and yeah.
I don't mean to interrupt. Maybe it's just me, but the slides aren't moving. So all I see is the first slide with the heading.
Oh, to me, I'm on the 3rd slide. I apologize.
Yeah, is that true for other people?
Yeah, it's not advancing for my screen either.
Yeah.
I'm so sorry. I really don't know why that is, because it says I'm screen sharing and it's showing. Let me stop sharing and start again, and we'll see. There we go.
If it doesn't work, I would just go on. I just wanted to.
Okay. All right. I'm going to try again. There, can you see that now? Listening session?
We don't see anything. So maybe
All right.
just go without it. So.
Okay. All right. I apologize. This is really, Teams is not my friend today. So this whole presentation is going to be put on the website after. So some of the major themes that we heard across the listening sessions, and again, because I went into detail about what we heard from the listening sessions last time, I'm not going to do that today. But I did list on the slides, and it is in Appendix F of the report, that some of the major themes we heard were that folks wanted better access to services, improvement in the assessment process, greater emphasis on and assistance with backup planning, earlier intervention and supports, improved employment support and job matching, revisions to current financing rules, expanding funding for home modifications, etc. And we'll get more into that when I start reviewing the recommendations. But we had a number of really critical themes that came across everybody who provided feedback. I would say the number one thing that we heard from the listening sessions was that we really needed to continue to support and expand self-direction, but also that we had to look at our quality of care, support our caregivers, and a lot had to be done in the area of housing and workforce development. So when it got time to write the plan, obviously the last 2 years of the 2019 to 2021 plan was marred by the COVID-19 pandemic. So we were dealing with a public health emergency as the final 2 years of our plan ensued. And as we start the 2022 plan, unfortunately, we're not quite out of that public health emergency yet. So what we did in the 2022 plan to address COVID-19 was we made the very conscious decision that this plan was not going to attempt to explore Connecticut's response to COVID-19 in depth. It's obviously, as you all know, that could be a report and a study all on its own, and every sector of the long-term services and support system could be studied and reported on separately. And in fact, that has been happening. So we're leaving the full scope reporting to others who have already undertaken that. What we did do in this plan was we did, of course, mention the effects of COVID-19 on the long-term service and support system. And we did try and point readers toward where they could go for more information if they wanted to read more in depth. So, for example, we acknowledge in this report that our long-term care populations in nursing homes were hit very hard, and that the Mathematica study was done to look at Connecticut's response in nursing homes and direct readers to the text of that report. We give some updates on committees that were formed to look more in depth at Connecticut's COVID response and provide links to their report outs, and also talk briefly about some of the federal funding that was made available to the state of Connecticut in order to address COVID-19. While a great deal of funding has been provided to the state, where we chose to focus was on the American Rescue Plan Act dollars, the ARPA dollars, and giving an overview of that special 10% enhanced home and community-based services funding that was provided by the federal government to Connecticut to improve our home and community-based services system. And while the plan itself doesn't go into detail about how Connecticut plans to use that those ARPA funds, what we do is direct our readers to the links so they can read Connecticut's Connecticut's spending plan and Connecticut's narrative if they want to learn more in depth about how Connecticut's using the ARPA funding. Where we decided to focus was on what we heard in public feedback from community organizations, from members of the general public and users of the long-term services and support system, from our advocacy partners, as to what lessons they learned and takeaways that came out of the COVID-19 pandemic. You know, a lot of strengths and weaknesses were highlighted in our long-term services and support system during this time. And there were three main trends that were stated by everybody, regardless of if they were coming at our long-term services and support system in a professional capacity, whether they were a nursing home operator or an advocate or a user of the system. We heard these three things over and over. And one was that the state must immediately and without hesitation begin to address workforce development issues, that recruitment, retention, across the long-term services and support system, whether it be home care or nursing home care, that we need to address a workforce shortage that Connecticut is facing. The second thing we heard was that, and really most strongly from informal caregivers and individuals who use the services and supports, is that backup planning for those who self-direct their own services. There needs to be a better focus on that, and that there needs to be assistance for individuals. What a lot of folks were reporting to us through comment was that they had paid caregivers who were suddenly during the pandemic quitting, getting sick themselves, or had their children home and could no longer work, and they were left with no care and had a weak backup plan in place that was hard to implement, and because of the corresponding workforce shortage, couldn't quickly find somebody to replace the caregiver who had quit or needed to reduce hours. And it was putting a lot of stress on the informal caregivers who were stepping in to fill that role. And many of those informal caregivers said to us, you know, when both the backup plan fails and the main plan fails and it falls to me, if anything happened to me, there's nothing. And my loved one goes without care, and it's very scary. So that was something that we heard repeatedly in every single listening session and in written comment on the feedback forms. Another comment that came up across populations was visitation policies. Here we focus on visitation policies in nursing homes because this is a long-term services and supports plan, but I will say visitation rules in hospitals was almost always mentioned along with visitation rules in nursing facilities. And it was that many informal caregivers felt that if their loved one got sick and needed temporary hospitalization or to go into a nursing home temporarily, they couldn't go in and make sure that appropriate care was being given. In some cases, they didn't feel anyone was there to speak on behalf of their loved one. Those who were in nursing homes full time, same issue. It was causing a lot of caregiver stress, a lot of stress on the individuals in the facility. And we were urged through comment to make sure that should anything like this ever arise again, that informal caregivers are not kept out of nursing facilities and hospitals, and that there is always somebody there to speak on behalf of the resident or the patient in the hospital who perhaps may not be able to speak for themselves. So that was a theme that came up. So the next thing that I wanted to talk about is we did get into our traditional statistics. And so our Medicaid statistics for SFY 2021, when looking at how many consumers are served in the community versus an institution, as you all know, the goal of our plan for a decade now has been that we are going to, by 2025, be serving 75% of consumers in the community and only 25% in an institutional setting. In SFY 2021, we saw that 70% of individuals, Medicaid clients, were receiving services in the community. That equates to about 31,000 individuals, and about 30% of Medicaid clients, around 13,000, were receiving care in an institution. And that is actually an 8% increase over 2020. And since SFY 2003, the percentage of Medicaid clients receiving care in the community has increased by 52%. So we've gone from 46% in 2003 to 70% in 2021. Now, we do have to put a little asterisk next to this year's rebalancing statistics, because we of course don't know exactly what role the pandemic played in increasing the number of individuals who were choosing to receive care in the community versus an institution. So it remains to be seen if that's a permanent change in our rebalancing numbers, or what effect that the pandemic could have played. But we can't just 100% say that 8% increase in care in the community was solely due to our rebalancing initiatives. The pandemic certainly could have played a role in that as well. And then for Medicaid expenditures, in SFY 2021, long-term care expenditures for individuals in the community versus an institution increased by 11% from 2020. So in 2021, we saw 60% of our Medicaid funds were for services, our long-term funds were for services provided in the community, and only 40% of long-term services and supports Medicaid funds went toward institutional care. Since 2003, when we started tracking this, the percentage of Medicaid long-term care expenditures for home and community-based services actually has increased by 94%, from 31% in 2003 to 60% in 2021. And again, we have the same pandemic caveat here. We can't say for certain that full 11% shift was solely due to our rebalancing interventions, and what percentage might have been due to some of the effects of the pandemic. So key facts and trends that we were able to report in our plan this time around. We noted from census data that disabilities affect 11.9% of all Connecticut residents. That's over 400,000 individuals. That comes from our 2019 census. Among older adults who living to age 65 during the period of 2020 to 2024, it's estimated that about 57% of them will need paid long-term services and supports over the course of their lifetime. But in general, it's anticipated that 70% of individuals who live beyond the age of 65 will develop some sort of long-term services and supports need. They just might not use the paid system to have their needs met. We continue to see the trend that women and low-income individuals have a greater chance of needing long-term services and supports, with 61% of each of those categories respectively being at risk of needing long-term services and supports, whereas men 65 and older, only about 50% will need long-term services and supports. So we know that home and community-based services have helped people with long-term services and supports stay in their homes and in their communities. We've seen proof that it helps reduce long-term services and support spending. Medicaid continues to be the major payer of long-term services and supports in Connecticut and nationally. And in state fiscal year 2021, Medicaid long-term services and supports accounted for approximately 15% of the total state budget and 39% of our state Medicaid budget. So I am going to pause for one moment before I get into just briefly reviewing our recommendation highlights to see if anyone has questions before I move on. Nope. Okay. So recommendations this year. We received a number of recommendations. So there are several, and I would say that if typically you kind of skim through the recommendation section and just give it a glance, this year I'd give it a full read through, because we really have what amounts to, between revisions and additions, a really fully overhauled recommendation section to the plan. It's very exciting, actually. Some of the recommendations changed because there's been a lot of progress, and some changed because we now have new areas to focus. We maintained our general key recommendation areas in that we are looking at the general categories of programs and services, infrastructure, financing, quality, housing, and workforce. Those remain the same. So under those categories, we first looked at long-term recommendations. What are things our plan can focus on 5 years and out? This section is largely unchanged, so I'm just going to put out a few things that we amended here. The few notable changes were that traditionally workforce development has been under a long-term recommendation. Clearly, with the feedback from everybody this time around, it has moved to becoming a short-term recommendation, meaning something that we really need to address in the 3 years of the current plan. One thing that was added under long-term recommendations was the need to prioritize and improve backup planning resources and assistance and access to emergency supports in the state's self-directed programs. And then a few of our long-term recommendations had some substantial revisions, such as the state providing more technical assistance and in helping communities to take an active role in helping their residents plan for long-term services and supports and age in their communities, provide support to informal caregivers that increase caregiver knowledge and confidence to deliver quality of care, and also exploring and expanding employment opportunities to ensure that employment options match the interests of the consumers who are being matched with those jobs. Those were all some substantial revisions to already existing highlights in long-term services and supports. I'm just going to try one more time because I don't want to read to you all of the recommendations to see if there's any possible chance my screen will share. And if not, I'll do my best to do a very quick overview. Okay. Does anybody see my screen now, my slides?
Yes.
You do? Okay.
It's just the first page, though.
Oh, geez. I don't understand why it won't move past the first page. All right. I guess it won't work. That's unfortunate. Okay. So I will do this quickly. Please know that you have the recommendations in front of you in the plan. You will get a copy of the PowerPoint after this so that you can look at where all the changes are. In the PowerPoint, I actually go through and mark the recommendations that are new or substantially revised so that you can see the changes for yourself. So under programs and services category for short-term recommendations, moving on to that section now, one of the main recommendations that is new and that we felt needed to be added based on feedback was to improve transparency throughout the assessment process and to make sure that individuals affected by the assessment process understand it and are actively included in it. There was a lot of call for the assessment process to be more transparent and for folks who are impacted by that assessment to be part of it so that the decisions aren't being made without them and without them understanding it and providing some impact, some feedback. The other two items that were new under programs and services was that there was a lens really shown on equity in our long-term services and support system. Connecticut has started focusing more on equity in the overall healthcare system and addressing some issues present there, but we haven't really through this plan focused on equity, and that's something that we tried to highlight in this plan, is to ensure that there's equity in all long-term services and supports programs and services through the availability of accessible materials, addressing social determinants of health, and ongoing evaluation of equity in the long-term services and supports access and health outcomes among traditionally underserved populations. We just want to make sure that everybody can access the system and that it's accessible to people no matter what language they speak or community they live in. Another thing that we heard across listening sessions was the need to increase earlier access to hospice services in the community and in institutional settings. Folks felt that there was not good information on that and they were coming to the service too late in the game. As we move under the category of infrastructure, there were several substantial revisions to items under this category. What I'll focus on for our purposes here are the new items, and that those are that we heard strongly through feedback that there's a need to eliminate the benefits cliff so that older adults and individuals with disabilities feel free to obtain and engage in meaningful employment without fear that they are going to then lose the benefits that allow them to engage in that meaningful employment. We heard loudly that some people, once they got a job, they lost their benefits and then they lost the supports that allowed them to actually get to and do their job. So that was one. Another item was to establish on-call supports for Medicaid recipients who self-direct their long-term services and supports, so that there's someone they can talk to when they run into trouble. They need somebody they can get in touch with right away with questions, concerns, so that they can succeed as an employer in self-direction. They felt more support was needed there. We also heard from the nursing home industry that there's a need to review and modify as necessary the current certificate of need process for skilled nursing homes to allow the state to work more collaboratively with nursing home providers as they seek to transition and transform their facilities. So taking another look at CON and how we can support our nursing homes as they try and become more flexible. The one substantial change under infrastructure to an existing recommendation that we had that I do want to mention is regarding the historical fragmentation of the Medicaid home and community-based service system. This has been a short-term recommendation in the long-term services and supports plan for years to address the historical fragmentation of the Medicaid home and community-based waivers, and that our waivers are associated with specific age and diagnostic eligibility criteria. What was added this time was that we also need to address the fact that these waivers are administered through varying state agencies with multiple different application processes. And folks were strongly saying that there needs to be some coordination between the state agencies and the waivers, not only with access and the application process, but also because our waivers are diagnoses specific and our state agencies tend to be diagnoses specific, that folks were feeling that they were being put into buckets and that they weren't being treated as a whole person, and that the overall assessment and waiver system needed to be looked at to address the whole person. So that's under infrastructure. Under financing, we had several changes under Medicaid financing list, or long-term services and supports financing, that you can peruse there. I will just highlight 3 of them. One was to, which was brand new, was to provide increased funding to school systems so that they can hire additional social work staff and special education staff in order to help, and to then provide training to that staff so that they can provide better supports to individuals and families of individuals with intellectual and developmental disabilities, to do earlier intervention and to be able to actually support families in applying for DDS programs and services, and not just giving them referrals to a number and sending families on their way. They felt school systems needed to be more hands-on, and that would be beneficial. There was also a call to address the long-term services and supports needs of immigrants who do not qualify for traditional sources of public funding and therefore tend to lack access to any type of care. A call to explore adjusting Medicaid spousal assessment rules, especially looking at those rules for individuals under the age of 65 who may be subject to spousal assessment rules. There was a strong feeling, particularly in one of the listening sessions, that individuals under the age 65 are more adversely affected by the spousal assessment. And then one that was heard across multiple populations was the need to explore the provision of Medicaid reimbursement or some type of reimbursement to paid caregivers so that they can visit consumers while they're temporarily in the hospital or in an institutional setting in order to reduce isolation and promote better health outcomes. We heard from consumers and paid caregivers alike that a lot of times the paid caregiver is the consumer's one person who sees them every day, who knows them, who knows their needs. And because Medicaid won't reimburse them, can't pay for them to go and visit them in a nursing home when they're in the nursing home or in the hospital on a temporary basis, that they get completely shut off from the one person who's their spokesperson and who really knows what they need. So that was something that was mentioned. Under quality, I will just, there was a lot of discussion about the need to improve quality of the services in the long-term services and support system, both in written comments and in the listening sessions. I'll just touch on a couple here. It was felt that the state needs to expand state oversight of services to individuals receiving long-term services and supports, including those provided in group homes, and that we need to take a look at including employee job performance, when we look at employee job performance in group homes, to also look at areas of the quality of the interactions that individuals have with the consumers who live there, and at the efforts that staff are making to engage with their consumer, to promote social engagement and stimulation, and that it not just be check boxes that that someone's been present and that someone's been fed at a certain time or had their medication, but that, you know, the rest of the time maybe the caregiver's on their phone. You know, is there actually social interaction going on that allows the consumer to feel like they're living in a home and that that person is engaging with them? Folks recommended that the state explore using a third-party non-state entity to conduct group home evaluations, and that there needs to be an unbiased evaluation going on. And then another new one under quality is to ensure that all long-term services and support care settings, such as nursing home groups, homes, and supportive housing options, have the ability, in accordance with applicable state and federal laws, to reasonably accommodate non-English speaking and deaf and hard of hearing residents by providing or arranging for appropriate interpretation services. And this goes beyond just services when interpretation services, when someone is having a medical procedure or an update on their health explained to them. We heard very strongly in the listening sessions that a lot of people felt isolated because by virtue of living in a nursing facility or a group home or supportive housing where there was no one that either was fluent in American Sign Language or that spoke a language other than English, and so they couldn't communicate with the people they lived with. And so that was something that we heard. I'm going to just quickly move through the last few. Under housing, we have a bunch of new housing options, so I'll just try and sum up that in general. Themes around housing recommendations were that consumers really wanted to be more involved in choosing where they live. They didn't want to just get placed in the first set opening in a facility that becomes available. That they should have, there needs to be more housing in local communities so that folks can decide what community they want to live in. And that it's important to try and do some matching so that folks are placed in housing that's culturally appropriate, where they're comfortable in the community that they live in. And again, getting down to making sure that if someone speaks a language other than English or uses American Sign Language, that they're in a community where there's others also doing that so they don't feel isolated. Now, one thing I want to point out here is this is one of those areas where David talked about having a massage. We had to be careful with rules about, in some of the recommendations, we really focus on just making sure that choice of housing in communities of one's that one desires to live in is made available, rather than specifying what certain housing facilities have to do or making it look like we're trying to cohort people and saying, oh, we got this, have this Spanish speaking facility here and we have this facility here. So really what it comes down to is choice. And that's what many of the recommendations in the housing section tried to address. The only other thing that under housing I'll point out is that we do talk about the need to expand home modifications to not only provide home modification funding to individuals with physical disabilities, but also that home modifications be made available for items that might be needed to modify a home for safety concerns that might be present for individuals who exhibit certain behaviors or have other needs. So not just looking at putting in a ramp, for example. So our last area is workforce. That's our last category. This area saw numerous new recommendations. I'll just run down a couple. Two were really around helping people to access the help that they need. One was coming up with some kind of registry or online direct matching system that allows folks who are looking for services to be able to find someone to provide them, but that is also detailed enough that it allows potential caregivers to add in certain specialized experience they might have, such as if they have experience working with an individual with Alzheimer's or working with individuals who exhibit behaviors, or if they've gone through training in behavior management, that would, you'd be able to go to a directory, see a list of caregivers and see where their skill sets lie. Along the lines of developing a registry in order to access workers was that folks, particularly in the listening sessions, felt that it would be extremely beneficial if there was some sort of pre-certified emergency backup registry of workers where when someone gets that call, hey, I'm not coming in today, and there's a registry, almost like a substitute teacher, where you could call up or look in the registry, not have to go through the full self-direction hiring process through the fiscal intermediaries, and be able to find someone that the state is pre-qualified to come in and fill in on a short-term basis that day, or for however long you need care. So that was one. And another one we heard was, we got a lot of comments about innovative ways to look at workforce recruitment, retention, development, and one was really taking the call to providing home and community-based services to the local communities and trying to recruit caregivers from all the local communities, so that somebody in New Haven hires a caregiver from New Haven, that person's going to know the neighborhood, going to know the restaurants, is more likely to be culturally competent, you know, in a way that matches what the consumer needs. So that was one that we heard. We also heard the need, a recommendation to start recruiting home care workers earlier, to make it a professionalized job where we engage boards of education and school systems to start the promotion of direct service home care as a career options for students as early as middle school. And very loudly, we heard that that once a good caregiver is heard, that the state needs to work on reducing the amount of time it takes to hire staff through their self-directed programs. And then finally, there were two new recommendations added around enhancing the training of the home care workforce, from unpaid caregivers to informal caregivers, to make sure that folks are trained not only in the physical tasks they have to do, but that there's cultural, cognitive, and behavioral health care training provided as well as needed, and that there's a way to create and communicate career advancement opportunities for the direct care workforce, so they can grow their skill set, and so that individuals who are hiring individuals to care for them have the latitude to pay a little more or provide some sort of incentive so that they can retain good workers once they find them. So I'm very sorry that I had to read that all to you and that my screen share didn't work. That was not my intention. I appreciate your patience. And I will just wrap up by saying our next steps for the plan are that you've all now seen the recommendations a couple different times. You've had the full plan for a week or so. We're hoping to vote on the plan today. The plan has to be submitted to the legislature by January 1st. And then we will post the plan up on the Long-Term Care Planning Committee website and distribute it to all of you.
And Melissa, thank you, and certainly don't apologize for the technical snafus. So it seems to be the order of the day. So that was a lot of information. Does anybody have any questions, comments? I should let you know I have received just a couple of technical comments from Michael Warner with the Advisory Council that we will adjust, but they're just nothing substantive. Margie?
Thanks. I wanted to say thank you, David and Melissa, for your work on this. This was a lot more involved than we've seen in past years, for sure. And to include and recognize the impact of the pandemic and the lessons learned was a really important piece that you did so well. And I really thought the listening sessions was a really important component as well. It was a welcome and valuable addition. I know you've got several pages on the feedback, but that you actually incorporated it into the recommendations and other pieces in the plan, and to have a wide variety of stakeholders included in this process and in the actual plan, not just in the process, but in the plan. I thought that was a real significant addition, and that was important. And I see the usefulness of this even beyond the plan. So thank you for all of that. I appreciate that.
Thank you.
Yeah, and I want to thank Melissa again for holding those sessions, but I also do want to acknowledge Claudio Gualtieri, who is Melissa and I's boss here at OPM, who was the one who suggested that we do more outreach to the community, and we came up with those. Well, Melissa came up with the listening sessions, and so I think we will certainly continue that in the future. So, any other comments or questions on the plan? Okay, at this point, I think we can just put it to a voice vote. I will tell you, Commissioner Porter had been on as part of the meeting. She had to drop off, but she did email me and say that she was an affirmative vote for the plan. So just to acknowledge that. So all in favor of the plan?
Aye.
I just need a second. You motioned, but I need a second.
Okay.
I'll
Oh,
second.
okay. Great. Thank you. Sorry.
Okay. Anybody? So all in favor, say aye.
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 Anybody opposed? Okay, great. We will we'll make the technical corrections that Michael made us aware of and double check everything. And then we will, as Melissa said, we will distribute it to the legislature January 1st and then post it on the website and get it out to everybody. So you'll have the final version. So, so thank you again, Melissa, and everybody for their input on this plan. So our next agenda item is to vote on a new planning committee chairperson, and this is a bittersweet agenda item for me. Some of you may know I'm retiring April 1st, and even though we're meeting in March, this is actually going to be my last meeting, and it's actually been an incredible honor to chair this committee from its inception in 1998 when I got roped into chairing, probably because nobody else wanted to do it, but it has been an incredible honor, and the state of Connecticut, due to the hard work of many of the people as part of this meeting, has made incredible strides in providing more options in the community, going back to us implementing a Choices for Everyone plan in response to the Olmstead decision, up to the statistics that Melissa just relayed to you, and the tremendous progress that's been made. And it's really been a privilege working with you folks and working with such a dedicated and talented employees. I think too often state employees don't get the recognition that they deserve. And all the folks that I've worked with, especially on the planning committee and on other endeavors.
You muted yourself, David.
Whether it's assisted living initiatives or other long-term services and supports initiatives, the folks I've worked with have been incredibly dedicated and committed to their work and have benefited the residents of Connecticut tremendously. And I think if the general public really knew what you folks did on a day in and day out basis, they would appreciate the tax dollars they pay and the work that gets done for them and for all the residents of the state. So with that, I just want to thank everybody and appreciate the opportunity to serve for the last 23 years. So with that, I'm extremely pleased that to nominate Melissa Morton to take over as chairwoman of the planning committee. And I'm grateful that she has agreed to take on that responsibility. And I have 100% confidence that she will do a tremendous job, mostly because she already does a tremendous job on the planning committee and the other work she does. So there's no doubt in my mind, as well as the other folks within OPM, that she will do a great job. So with that, we have to vote on a new chairperson. Melissa will have to be officially appointed by the Secretary of OPM. That will happen in the new year, and then she will take over as chairwoman at the March meeting. So, so do I have a motion to approve Melissa Morton as the chairwoman?
So moved.
Erin, second.
Second.
Margie seconds. Okay. I should note that Commissioner Porter also voted in the affirmative to have Melissa be the chair. So with that, all in favor say aye.
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 Anybody opposed? If you're opposed, Melissa will come down and hunt you. Anybody opposed?
I don't think anyone would after that.
Yeah.
Melissa, you're such an opposing figure.
I was going to say, you can't tell when I'm sitting that I'm only 4'11". So you don't have to worry.
Okay, well, I appreciate everybody's agreement in making Melissa the chair, because if not, then I couldn't retire. So.
Oh, forget it then. Let's take it back. Well, David, I just want to say thank you for your leadership. And first of all, as an employee, I couldn't have learned from a better person. But I think this group is going. I do not look forward to trying to fill your shoes. I don't think I can. But this group is definitely losing the benefit of your years of experience and dedication. And I'm going to text you constantly. So.
Okay. Thank you, Melissa. I appreciate that. So with that, let's move on to any comments from the advisory council, Michael or others.
Thank you very much. And I just want to also thank you both to David and Melissa. David, congratulations on your upcoming retirement. Congratulations on a wonderful report. And I think it's an important one too. And I think it's going to be kind of a great guiding document going forward in a lot of different ways. And I can already see its applicability in other areas that our state's working on. But amazing to see the new statistics, the new 70-30 ratio already. And we're going to have our meeting tomorrow where at the Long-Term Care Advisory Council, we'll have David and Melissa be joining us. And I'm just absolutely delighted with how this worked out. And I'm also echoing about how much I've been able to learn in a relatively short period of time from David and Melissa too, and through your leadership. So just thank you very much.
Thank you. And thank you and the advisory council for all your help with the plan. So
My pleasure.
Okay, any other business announcements, comments? Margie?
Oh, I just wanted to say thank you, David, for leading this group for all these years. And it's been a pleasure working with you on this committee. You've been so dedicated to it. And I'm glad you got to see all the progress over the years. And it got summed up in Melissa's presentation there. So we thank you for that. And I very much look forward to working with Melissa. Melissa and I have known each other over 20 years and worked together in various capacities. She's amazing. So I'm really excited about that. So thank you both.
Thank you. Okay, any other comments before we adjourn? Michael?
If you don't mind, David, I've had the pleasure of working with you for longer than I would like to say. I think everybody on this committee knows, but for those who actually see this on CTN, the state of Connecticut will never, its citizens will never know how much good you, all the people you have led since you've been in state service, how much good you have done. I've personally learned a lot. I had the pleasure of working with you for, as I said, too many years. I envy your retirement. I hope you enjoy it. Know that you will be missed, not just by the people here, but by the citizens of Connecticut who don't know your name, who will never know your name, but will feel the benefits every single day of their lives. Thank you.
Thank you. I appreciate that. Okay, well, that's a good note to end the meeting, right? So, I have a motion to adjourn.
As always, motion to adjourn.
Michael, second.
Second.
Margie. Okay. We are adjourned. Thank you, everybody. Have a good day.
Thank you.
Thank you.
Happy holidays. Bye-bye.
Thank you. Bye.